I love bread.
Oh, my tummy hurts so much and I feel so bloated. I wonder why this always happens to me after I eat bread. I wish someone could tell me why.
Well, hello, Rikki. I am the gluten fairy.
Gluten fairy? What's gluten?
Well, I believe you're presenting with some signs and symptoms of a disease called celiac disease, also known as gluten intolerance.
Gluten? That sounds a lot like Putin. You're not from Russia, are you?
No. Gluten, not Putin. It's a protein found in barley, rye, and wheat.
Well, why is it making you feel so sick?
There's a component of gluten called gliadin, which contains toxic components. So when this gliadin goes undigested, it is resistant to break down by gastric, pancreatic, and intestinal proteases in the intestine, and there it remains. Where there is an increase in permeability of the epithelial layer, gliadin crosses and is absorbed into the lamina propria from the lumen. Here it interacts with the HLA class II, DQ2, or DQ8 molecules embedded in the cell membrane of antigen-presenting cells as the cell surface antigens. The gliadin peptides attach to these antigens and then are presented to helper T cells. These T cells produce pro-inflammatory cytokines, which are chemical messages that begin an inflammatory cascade that releases metaproteinases and other tissue-damaging mediators that induces inflammation of the intestine. With this inflammation cause damage to the villi, which produces lesions and decreases the ability to absorb macronutrients such as carbs, fats, and proteins.
So when I eat gluten, it damages my intestines?
Yes, exactly.
Well, how come when my friend Cassidy eats bread, she doesn't get a stomachache, but I do?
Well, you remember that HLA, DQ8, and DQ2 molecule I was talking about?
Yes.
Well, one possibility for your intolerance is that you have that molecule, whereas in the normal physiology of a human, they don't. But this does not limit your reasons as to why you have celiac disease.
Well, what are some other factors involved?
Well, there has been some studies on breastfeeding that it shows to decrease your chance of getting celiac disease versus the infants that are fed formula, as well as if you have a first-degree relative with celiac disease, increases your chance of getting celiac.
How common is celiac disease?
Studies show recently that it's an increasing rate right now, but currently it only affects 1% of the global population, with more of that 1% being women than men.
Does everyone show the same signs and symptoms as I do?
No, not necessarily. Everybody shows different signs and symptoms. Some of these signs and symptoms that can be present are stomach pain, gas, bloating, chronic diarrhea or pale and foul-smelling bowel movements, weight loss, bone or joint pain, dermatitis herpetiformis, which is a painful rash of itchy blisters, or anemia.
So let me get this straight. In bread, there is a protein called gluten that contains gliadin that when it is undigested crosses the epithelial layer in the intestine and binds to the HLA DQ2 or DQ8 molecules that are embedded in the cell membrane of the antigen-presenting cells. Helper T cells come along and initiate inflammation in the intestine that damages the villi, which causes a disruption of homeostasis in the digestive system. And that is why I have stomach pains and get bloated and have diarrhea.
Exactly.
Thank you, Gluten Fairy. I'll try to stay away from the bread from now on.
You're welcome.